Hello doctors, I am Dr. Siddharth Gupta and I am an orthopedic surgeon. I have been receiving requests from the students that I have to summarize eponym fractures in one single video. So friends, I have made this video to summarize all the eponym fractures so that you can answer almost all the questions pertaining to eponym fractures that are particularly the one-liner questions in the NEET PG examination, and after seeing this short video you will be able to answer all of them. I'll be giving you visual impression as well so that you can remember the eponym fractures easily. We begin with the lower limb. In lower limb we'll start with tibia. Friends, this is the tibia bone. This is the tibia bone. This part is the lateral part and this part is the medial part of the distal tibia. This is the medial malleolus. This part will articulate with the fibula. So we begin with the eponym fractures. This part is the lateral part. The depressed fracture of the lateral tibial condyle somewhere here is called as the bumper fracture. Why it is called as a bumper fracture? You can imagine that if a person is crossing a road and he is hit by a car, something like this, so the lateral part of the tibia is hit by the bumper of the car. That is why it is called as the bumpers fracture. In tibia, the other eponym fracture is the fracture of the bimalleoli. That is, this is the tibia and this is the fibula. Both will articulate with each other to form a bimalleolar joint or an ankle joint. This is the medial malleolus, this is the lateral malleolus. When both of them fracture together, it is called as the bimalleolar fracture. Popularly known as the Potts fracture. You can remember it by a simple mnemonic. You say BP, blood pressure, an acronym for BP. Now, if you can extrapolate it, that bimalleolar fracture is also known as Potts fracture. Now, if you see the tibia laterally, you will see something like this. This part of the tibia is called as the posterior malleolus. In the lateral view, if you see the tibia, this part is called as the posterior malleolus. Now, when the two malleoli, that is the lateral malleolus and the medial malleolus, to fracture together with the lateral malleolus, then it is called as the trimalleolar fracture. The trimalleolar fracture is popularly known as the Cotton's fracture. You can simply remember it by a mnemonic CT scan. CT is Cotton's and T is for trimalleolar fracture. The other fracture in the lower limb that we have to study is that we move on to the Tilloch's fracture. Tilloch's fracture is also a fracture of the tibia. Which is seen in particularly skeletally immature patients. That is, the distal tibial epiphyseal region. This region undergoes an avulsion fracture. This is the avulsion fracture of the distal tibial epiphysis anterolateral part. Avulsion fracture, that is somewhere here, will lead to Tilloch's fracture. Most of the time it is seen in skeletally immature patient. However, it can be seen in skeletally mature patients also. If it is seen in skeletally mature patient, it will involve the metaphysis as well. But in any case, it will be involving the anterolateral part of the distal tibia. It is called as the Tilloch's fracture. We move on to the foot. In foot, if a person jumps from a height, he breaks his calcaneum. That is called as the lover's fracture. Lover's fracture because in older times, lovers used to commit suicide by jumping from a height and they used to break the calcaneum. That is why it is called as the lover's fracture. The next fracture in the lower limb is the aviator's fracture. Aviator's fracture is the fracture of the neck of the talus. Now, why it is called as the aviator's fracture? Because in the olden times, in the jet planes, there used to be a pedal which used to be pressed hard by the foot of the pilot, and that is why sometimes it backfired. Sometimes it used to backfire and used to break the talus. That is why it is called as the aviator's fracture. Aviators has something to do with the flying or the pilots. Then we have the Chopard fracture. Chopard fracture is basically a fracture dislocation which involves the intertarsal joints. The intertarsal joints are the calcaneocuboid and talonavicular joint. Calcaneocuboid and talonavicular joint are the intertarsal joints, and a dislocation involving this is called as Chopard fracture dislocation. We move slightly distal, that is the tarsometatarsal joint. Tarsometatarsal joint fracture dislocation is called as the Lisfranc fracture dislocation. Tarsometatarsal joint fracture dislocation is called as the Lisfranc fracture dislocation. You can remember L, low, F, foot. So low foot or distal foot tarsometatarsal joint fracture dislocation is called as the Lisfranc fracture dislocation. The fracture of the base of the fifth metatarsal, which is caused by the pull of the peroneus brevis, an eversion fracture, is called as the Jones fracture. Friends, this is all about the lower limb. In lower limbs, if you know this much of the eponym fractures, you will be able to answer almost all the questions. Now we move on to the upper limb. In upper limb, we begin with the radius. Radius. This is the radius bone. This is the radial head. This is the distal end of the radius. This is the styloid process. This, which I have marked with the pen, is the styloid process of the radius. This is called as the styloid process of the radius. We begin with this only. The styloid process of radius used to fracture because in the older times, when in the 19th century, there used to be something called as the hand cranking mechanism to start a car, in which the driver used to pump the car by turning on a lever. Sometime that lever backfired and it used to hit the styloid process of the radius. Now that is called as the chauffeur's fracture. Chauffeur is the other name for the person who drives the car, or the person who has a business to drive the car. So it used to backfire and hit his radius and hit the styloid process of radius. That is why it is called as the chauffeur's fracture. It is called as the chauffeur's fracture of the, which is the fracture of the styloid process of the radius. Now we move on to the distal end of the radius. Distal end of the radius. This is the cancellous part of the radius, and this is the cortical part of the radius. Now this part is called as the cortico-cancellous junction. This part is called as the cortico-cancellous junction. This part is commonly fractured in middle-aged person, especially when they fall and they try to protect themselves by laying down their hand on the floor. So this part is commonly fractured, which is approximately 2 centimeters from the distal radial articular surface. Now if this part fractures and goes dorsally, that is called as the Colles fracture. You can remember it as CD player. You use CD player. So Colles dorsal, just remember that. Now the reverse of Colles is Smith. That is, if the distal end radius fractures and goes volarly, that is called as the Smith fracture. Now in this, if I see the radius in this view, that is the lateral view, and not the AP view but the lateral view. Now if there is something which is fracturing it like this, instead of this fracture line, if there is a fracture line somewhat like this and extending up to the articular surface here, that is something like this. This plane is called as the coronal plane. So a coronal plane fracture of distal end of radius, such that it extends into the articular surface and at the same time it subluxates the carpal bones as well. It is called as the Barton's fracture. Now you can simply remember it by a mnemonic which is called as BC. C comes after B, So you can remember BC. That is Barton's fracture is a coronal plane fracture dislocation. If it is taking place in the anterior part, then it is called as the volar Barton. If it is taking place in the dorsal part, then it is called as the dorsal Barton. Then it is called as the dorsal Barton. So in distal line of radius, you have a lot of eponym fractures, but if you try to visualize them, you can easily remember them. It's not that difficult. Now we come to the ulnar bone as well, which will articulate with the radius, which will articulate with the radius somewhat like this. This is also a radius bone, but I am using it for articulating with the radius because I do not have an ulnar bone at present. So what happens is that radius and ulnar articulate somewhat like this, and now we'll be discussing all the fractures which have a combined implication. In this, the two fractures are the Monteggia fracture dislocation and Galeazzi fracture dislocation. I remember Monteggia by a simple mnemonic which is called as MUS, Muse. Now Monteggia, M stands for Monteggia M, U stands for ulna, that is ulnar fracture, and S stands for superior radio-ulnar joint. So if there is a fracture of the ulna, somewhere here in the proximal part, and there is superior radio-ulnar joint subluxation, that is called as the Monteggia fracture dislocation. Its variant is called as Hume's fracture, which takes place in children, in which instead of fracturing of the ulna proximally, it fractures the olecranon process of the ulna and at the same time subluxates the radiocapitellar joint. That is called as the Hume's fracture. Now there is another fracture which is similar to this Monteggia but takes place at the lower part of the forearm, that is called as Galeazzi fracture dislocation. Galeazzi I remember by a simple mnemonic which is called as grip, G-R-I-P, grip. Galeazzi, G for Galeazzi, R for radius fracture, I for inferior radio-ulnar joint. Now P is silent in this. P has nothing to do with this mnemonic, but still to remember it, I remember it as grip. Now what happens is there is fracture of the distal third of the radius and there is subluxation of the distal radio-ulnar joint. Distal radio-ulnar joint is also abbreviated as drudge, D-R-U-J, drudge is also abbreviated as drudge. Now there is another fracture of the ulna which is called as the Nightstick fracture. Now what is Nightstick fracture? If you are roaming around in a street at night and somebody tries to hit you by a stick like this, and what you will do is you will try to protect yourself like this, and somebody is hitting the stick like this. So in this process, this is my ulnar border of the forearm. I will end up breaking my ulnar bone. This is called as the Nightstick fracture. This is all about the forearm, friends. Now we move on to the humerus. In humerus, we have to discuss just one eponym fracture, that is the Holstein-Lewis fracture. Holstein-Lewis fracture is nothing but just a spiral fracture. This is something like this. A spiral fracture of the distal third of the shaft of the radius. Now at this part, the radial nerve pierces the lateral intermuscular septum and comes to lie anteriorly. So at this part, the radial nerve is most notorious to get injured, and here when there is a distal third fracture of the shaft of the humerus and at the same time injury of the radial nerve, that is called as the Holstein-Lewis fracture. So we have finished with the lower limb. In lower limb we did tibia, foot. In upper limb we did forearm and the arm. Now we move on to the hand. In hand there are a few eponym fractures. Firstly, we have to study about the base of the first metacarpal fracture. That is the base of the first metacarpal fracture. This is the first metacarpal base. Mind you, this is not the first metacarpal base. This is the first metacarpal base. Now, the fracture of the base of the first metacarpal is called as the fracture of the base of the first metacarpal is called as the Rolando fracture or the Bennett's fracture. Now, both of them are intra-articular fracture. What is the difference between the two? See, Bennett's fracture is usually a transverse fracture and sometimes incomplete fracture, and it involves the subluxation of trapeziometacarpal joint as well. But Rolando fracture, which is also an intra-articular fracture, involves the base of the first metacarpal, and it is usually a T-shape or a Y-shaped fracture. Friends, mind you, in some books it is given that Rolando is an extra-articular fracture. Bennett's and Rolando both are intra-articular fractures of the base of the first metacarpal. So always remember this, do not confuse between the two. Then we come to the boxer's fracture. Boxer's fracture is simple to remember. Whenever somebody is boxing, the neck of the fifth metacarpal is fractured, that is called as the boxer's fracture. The fifth metacarpal neck is fractured, is called as the boxer's fracture. We come to the mallet finger. Mallet finger is that when there is an avulsion, then there is an avulsion of the extensor tendon from the distal phalanx. Then there is an avulsion of the extensor tendon from the distal phalanx. It will take a part of the or chip of bone from the distal phalanx from here, and the finger will become somewhat like this because it is not able to extend. Now finger will become like this. This is called as the mallet finger. This is called as the mallet finger. The reverse of this is a jersey finger. The reverse of this is a jersey finger, in which what happens is that the flexor digitorum profundus, which inserts here, is avulsed, and now you cannot flex this finger like this. It will be like this only, and that is called as the jersey finger. That is called as the jersey finger. Now we come to one more injury, which is called as the gamekeeper's thumb. It is not a fracture as such, but still you must be knowing it, since we are discussing eponym fractures, that whenever a baseball player or a gamekeeper or a wicket keeper tries to catch the ball is usually held between these two fingers of our hand, that is the thumb and the index finger, and sometimes it stretches this part. There is a ligament here which is called as the ulnar collateral ligament, that undergoes injury, and that is called as the gamekeeper's thumb. In cricket players, this is also common, who are good at fielding, holding the ball. They are trying to catch a speedy ball coming to them. This is called as the gamekeeper's thumb, which is the injury to the ulnar collateral ligament. Now we move on to the spine. In spine, you have to study a few eponym fractures. This is the atlas vertebra. Whenever there is an axial load on this, there is a burst fracture. Of the atlas vertebra, which is called as the Jefferson's fracture. Jefferson fracture usually does not involve any neurological deficit because the spinal cord is usually spared in it. Now we move on to the hangman's fracture. That is the two vertebrae C2 and C3 articulate like this. C2 and C3 vertebra articulate like this. The hangman fracture is basically a subluxation of C2 over C3, something like this. The C2 vertebra subluxates over it, and sometimes it gets fractured also from the pars interarticularis of it, and then it is called as the C2 over C3 fracture dislocation. There is another fracture which is called as the Clay-Showler's fracture, in which the spinous process, this is the spinous process of the C7 vertebra, or sometimes the T1 vertebra as well. If you are asked to mark 1, then you have to mark C7. Spinous process of C7 undergoes an avulsion fracture. It was usually found in clay shovelers. Clay shovelers were the people who used to dig the soil and used to throw out the soil from a ditch or from a deeper part, from a deep hole. So they used to throw the soil up, and in that process their neck used to tilt like this, and it used to fracture the spinous process of C7 vertebra. Friends, this is all about the eponym fractures. If you read and remember these eponym fractures, you will be able to answer most of the questions. Thank you.